Europe. C3 is a small global health charity focused on the prevention of chronic disease by looking particularly at the main risk factors, the things that drive ill health, smoking, what we eat and drink, lack of physical activity. And we've always been interested in workplace health. There's a time when people are 16 to 70, often working in groups, although less so at the moment, as we'll hear, and still have the opportunity to change. And when the pandemic first struck, I remember thinking, no one's going to be interested in chronic disease now, as this understandable fear and concern of this contagious, highly contagious epidemic. And then relatively quickly, it became sadly obvious that those people suffering from chronic disease and from the risk factors, particularly things like obesity and hypertension, were going to be among the most vulnerable, and in particular, the most disadvantaged people. So today's seminar is going to be particularly interesting, I think, for all of us. I'd like to thank our sponsors, Sanofi Health Management, part of Maximus, and Towergate Health and Protection, three companies who certainly, in addition to sponsoring us, practice workplace health, have a strong ethos of health for their own employees and in the way they work with customers and clients. Just a few housekeeping rules. We'd like everybody to be on mute. Entirely up to you whether you keep your video on or off. Please use the chat function for comments, suggestions, but most of all, for some questions for Steve towards the end of the session. The session will be recorded, and the recording and the slides will be available to everybody later. So just moving on to a very warm welcome to Steve Bevan. He and I were agreeing that it was so long ago we first met that we probably shouldn't try and remember. But when I worked at the RCN, Steve led what I guess is still the most important longitudinal study of the health and well-being and attitude to work of Britain's nurses. Since then, he's led the Work Foundation through some interesting and challenging times, and is now heading the research function back at the Institute of Employment Studies, and is somebody who everybody recognises as a strong voice of workplace health, particularly some of the work he's done around musculoskeletal work. But today I think we're going to learn the huge impact. Anybody who's been involved in employment and workforce issues, the impact of this pandemic has been amazing, and we're really interested, Steve, to learn from you the research that you've conducted, and I'm sure we'll get some ideas and generate some questions and some discussions. So over to you, Steve.
Brilliant. Thank you very much, Christine. It's great to be here and reconnecting with many old friends and some new friends, hopefully. I'm going to talk for probably about 40 minutes, just giving an overview really of some of the things that we've been finding, and giving you some specific results from our survey of people working from home, looking particularly at their well-being. But it was very interesting, putting these slides together to use it as an opportunity to really reflect on what the research, and vast amount of research, for example, has been done since the beginning of the pandemic. It's been interesting to see how the research community in the UK and internationally has been able to mobilise so rapidly to do so much really good and insightful research under very testing circumstances. I maybe think back to another piece of work I did many years ago in the NHS, where we asked a very open question in a questionnaire, which was, what can your managers do to improve your well-being at work? And it was really interesting that we got answers like, keep us informed, treat us like adults, involve us in decisions that affect our future. That almost none of the answers were very medical, and that employees didn't really think about well-being in as medical a way as some of us have perhaps got used to thinking about it. And for me, that was quite a good reminder that we need to use the term well-being in a very broad sense, in a very broad definition. And that's certainly how I'll be using it today. Although some of the data I'll be presenting, is quite clinical in the sense that we've got some self-reported data around people's musculoskeletal health and their mental health and so on. Actually, it bleeds into a whole range of issues around culture, management, work organisation, job design, and so on, all the things that we were familiar with in the sort of world of workforce health. But the lens of COVID-19 and pandemic and lockdown and so on has perhaps made us think a little bit about what all those things really mean. And most particularly, how we're going to manage all this in the new reality of post-lockdown, whenever that comes. Because I think there's some fairly fundamental things that have happened which are likely to remain with us regardless of what happens next. So it's those sorts of themes that I'll be picking up on, and obviously very happy to take questions at the end. The sort of topics that I'm going to be talking about are just reflecting on some of the things we've learned about wellbeing in different employee groups. I want to take you through the headline findings of the survey that we started on the 28th of March, so only 5 days after lockdown. I think we were probably one of the quickest off the mark to get a survey out there to monitor people's well-being during lockdown. How all that affects things like job quality, management and their links with well-being. A few reflections on what I think some of the remaining challenges and evidence gaps are. And then a little couple of examples of some of the ongoing IES research that we're doing that hopefully you'll be interested in staying in touch with. So in terms of the sort of wellbeing challenges during the pandemic, most of you will be incredibly familiar with most of these, and I'm going to be focused on the working from home dimension. And I recognise for a start that working from home for many people is actually a relatively privileged position to be in compared with having been in the front line, for example. So whilst the findings of that work are really important, it's really important to recognise that there are many key workers who've been working in the front line, and particularly in the early days of the pandemic, putting themselves at considerable risk as the PPE supply issues were being resolved. So for key workers, there were PPE challenges. There are obviously big issues around how you do proper risk assessment. We've had the very troubling findings about the elevated risk of infection and mortality amongst Black, Asian and minority ethnic employees in the front line. Lots of challenges around mental health, and it's great to see so much good work being done there, particularly for people in the NHS, dealing with mental health challenges, trauma. The issue of burnout has come back, and whether or not how we define that, how we measure that, I think is still a big issue and lots of debate. And then the challenges of moral injury, which I think my reading of it is that most of the original research in that area was done mostly in the military. But certainly people again in the NHS in the front line have been put into really difficult positions, not allowing relatives to visit dying relatives and so on. Moral injury as a sort of another dimension of the mental health problem, I think is challenging. I noticed someone, I think on Twitter, was saying that potentially there may be some moral injury issues in the Walter Reed Medical Centre, but I won't go into that in detail. Then we have the challenges of looking at well-being amongst vulnerable groups. And I'd certainly like to pay tribute to the work that the Society of Occupational Medicine and collaborators have done to look at things like vulnerability stratification amongst vulnerable groups. I think that some of that work has been incredibly helpful, particularly to help employers and occupational health professionals to look at risk factors. Again, Black, Asian and minority ethnic workers have now clearly been identified as vulnerable. Older workers, those living with obesity, and those with other high-risk comorbidities. And that's something where I think our knowledge and our expertise has grown very significantly, and I think plays at least some part in the relatively lower levels of mortality we're seeing in the sort of so-called second wave. Obviously, that's more complicated than that, but I think our knowledge around those vulnerable groups has increased significantly. The group I want to really focus on are those people who've been working from home, and to look at their physical and emotional well-being, a whole range of things around lifestyle. But this is where it gets more managerial. So how their wider well-being has been affected by how well they've been managed, how the culture of organisations have adapted, how communications have been managed in terms of remote working, and how work-life balance has been challenged as well. And I think it's interesting to reflect that for those of us who've been campaigning for many years for boards and senior managers and senior executives to take workforce well-being seriously, all of a sudden workforce health was catapulted up to boardrooms as being probably the most important priority, because it became a business continuity challenge. You know, how do we keep the lights on? How do we keep this organisation going? How do we use the insight and expertise we have inside the organisation, or indeed outside it, to optimize well-being, to make sure that, you know, people can retain their jobs, that we can keep our customers going, deliver our products and services. And I guess one of the challenges is to make sure that once things calm down, which we all hope they do, that the issue of workforce health doesn't get relegated again to something which is a nice to have. And that's perhaps our biggest long-term challenge as a sort of as a community. So let's focus just for a few minutes on home working. You will have probably been bored to death by the number of surveys that have been done over the last few months on working from home, and most of them, at least my reading of them, have come up with broadly similar findings, which give me some faith that they're tapping into some themes and challenges. Because of course, methodologically, doing a survey of people working from home, particularly where you're trying to be opportunistic, and as we were, and coming up with a questionnaire within days of lockdown, means that from a scientific point of view, you have a self-selecting sample. And that's a challenge. You know, it's really hard to know to what extent you can really generalize from these findings, because they happen to be a snapshot of people's responses at a particular point in time. We didn't have the advantage of, you know, having a sample from which to draw in a scientific way in terms of stratification and random selection and so on. All the results I'm presenting, you have to bear in mind, is from a self-selecting sample, and when you look at the demographics of the respondents, you'll notice you know, some sample biases. But bearing in mind that we were trying to act quickly and capture a moment in time, I still think there are some interesting and meretricious findings from the study. It was, just to remind you, 23rd of March. It was a very rapid shift of working patterns, and you know, millions of people were all of a sudden working from home. I think the figure in the UK before lockdown was about 12% of people had the option to work regularly from home. I think the ONS survey suggested at its peak that it went up to almost 50% of adults in the UK were working at home for at least part of the time, if not most of the time. And of course, that raised big questions about how people adjusted to that shift, but particularly how their physical and emotional health were affected, and also how well employers responded to that. So whilst these data do include some sort of more clinical findings, as I mentioned before, it's really important not to over-medicalise this. So the IES survey was launched on the 28th of March. I won't go into the history of IES, but it is you know, part of our sort of DNA to conduct applied research on the issues around the workforce and the workplace, and how things are going in the labour market and in workplaces. There's been a whole other strand of work that IES has been doing, looking at the long-term impact of lockdown and the pandemic on jobs, looking at the job retention scheme, looking at how vacancies are playing out, you know, what's going to happen next in terms of what government policy should be in terms of wider active labour market policy. My focus and the focus of my immediate colleagues has been on what's been going on in workplaces, even if that term doesn't have much of a meaning anymore. You know, is work a place or an activity? So we've been collecting data since late March. We've used the WHO 5 index of mental well-being, which has proven to be quite helpful in comparing subgroups and also as an outcome measure. And I'll talk a bit more about how we've used that. We've got data from almost 900 respondents now. We've closed the survey, and all the data that I'll be presenting here in terms of beyond the descriptives, in terms of correlations and so on, are all statistically significant. Let's have a very quick look at who the respondents were. So 70% of the people we were surveying were working at home only because of COVID-19. So as a minority who had been working at home prior to the pandemic, and actually that was quite a useful subgroup to compare against. The population was 70% female, average age 46. Quite a large proportion of them were homeowners, for example. So we're not talking about people in the precarious part of the labour market particularly, and mainly in white collar jobs working for larger service sector or public administration employers. Just over 40% were sharing a workspace with another adult. About a third had dependent children, 16% had elder care. We found in the survey that obviously things like homeschooling, working with other adults who were also wanting to have broadband and bandwidth and time to do their own work was a challenge, particularly early on. About 46% of our sample were managing other people. And I think there is an issue about, the health of managers in this whole thing, which I'll come back to a bit later on. About 60% said they were working longer than their contracted hours per week. 85% said they had immediate access to IT provided by their employer. 73% had access to occupational health, 64% to EAPs, and that reflects the fact that most people working in larger organisations, I think. About 25% said that their employer had carried out a risk assessment, and that appeared to be mostly remote workplace assessments and advice around how not to stay hunched over your laptop on the kitchen table. But I have to say quite a lot of that was quite late in the day. I think there's some debate about how swift the HSE was in providing advice on some of that, on some of those issues. In terms of physical health, it was quite interesting. We are asking people about whether or not they'd had symptoms of pain and aches and discomfort in various parts of their body. And we're asking them essentially whether or not these physical symptoms were worse than normal over the previous 2 weeks prior to the survey. So it is a snapshot in time. And the fact that we kept the survey open for several weeks has allowed us to look at how those symptoms have changed over time. The early responses showed quite a big spike in musculoskeletal pain. Something between 50 and 60% of respondents were reporting pain that was worse than normal across most sites in their musculoskeletal system. Over the weeks of the survey, these symptoms, the severity of these symptoms seemed to reduce. But there's still a residually relatively high level, I think, of pain, particularly in the neck, the back and the shoulder. Something around or in excess of a third of respondents said that are saying that pain in those areas is worse than normal in the last couple of weeks. Again, a significant minority of people reporting eye strain, headaches and migraine and so on. We saw similar increases, but also similar reductions in chest pain, leg cramps, heartburn, and so on. But I guess overall, at least 25% of people have a remaining challenge around some symptoms of pain in some site of their body or impairment in terms of eyesight and so on. Interestingly, we found a correlation, not saying it's necessarily causation, between those respondents who reported lower levels of pain and those who'd had a risk assessment. Now that's quite a nice finding if it shows some sort of causal link, but at the moment it just remains an association. probably can't see this graph particularly well, but essentially what this is they're taking along the bottom all the different sites, so neck, shoulder, elbow, wrist, hips, and so on, and comparing those reporting severe symptoms in early April 2020, and then in June 2020. And you can see across the board a reduction in the self-reported severity of those symptoms. What I would say is that some of those reductions are larger than others, and the fact that we've been able to monitor them week by week through the survey suggests that the decline in the severity of the symptoms has been relatively steady. And I think it's not unrelated to employers perhaps initially been distracted by all the complexities of managing lockdown, eventually beginning to get their act together and thinking about how they can support the well-being of people working at home. And certainly lots of stories of people being given proper support, desks, chairs, and other support for working at home, particularly using laptops. There are a whole range of other things. Sorry, go back to that slide. On the right-hand side, there are a few other issues that were troubling people. So sleep, lost sleep was a big issue and remains a big issue, actually, although it has declined as a challenge, and fatigue. And obviously, the fatigue can be partly as a result of lost sleep, but also it can be related to chronic musculoskeletal pain. And that's something I think that perhaps we need to think about a little more, particularly as we look at the data around people working excess hours. So about half of people reporting losing sleep due to worry, largely over finances and over the health of a loved one. 43% report more fatigue than usual, and then a whole bunch of other lifestyle issues. 25% say their alcohol consumption is up compared with prior to lockdown. 60% worry they're taking too little exercise. A third say they're eating unhealthily. A third say that their work pressure is too much, and just under a half say they don't have enough time to get their work done. Now, obviously, we don't have precise comparisons with what these data would say prior to lockdown. Obviously, we know that particularly for perhaps slightly more senior people in white collar jobs, these tend to be part of the landscape anyway. So it would be wrong to conclude that lockdown has caused all these challenges. They may have elevated them or amplified them. But I think if we're going to manage more variability in working patterns after the lockdown, and if more people are going to be working at home for at least part of the time, these are the sorts of things that give us a sort of menu of issues that we need to deal with preventatively, and to look out for if we're going to make sure that it's a sustainable option to get people to work more frequently from home. In terms of mental well-being, there's sort of a mixed picture really, and this issue obviously has taken a lot of attention over the last few weeks. Real concerns about the general psychological well-being of the population, let alone the working age population. As I mentioned before, we've used the WHO-5 measure, and what we found was that in general, younger workers had lower scores, and that was largely, I think, because they had more concerns about finance, housing. Lots of them were living in shared houses, or even worse, living with their parents, God forbid, job security, isolation, and so on. And you can see from this graph very simply that the WHO score is considerably lower for those under 29, gradually increases. So those 60 plus were reporting higher levels of mental and emotional well-being than the younger groups. I mentioned that 70% of people working at home only because of COVID. The 30% who had been working long-term at home, you won't be surprised to hear that they adjusted very much better. Their WHO score was much higher than those who were new to lockdown. What I would say is, though, if you plotted the WHO-5 measure across the time that we conducted the survey, actually we didn't really notice either a decline or an improvement in mental health across the board. But as I said, there were quite significant differences between subgroups. So we found, for example, that there was better mental health reported amongst those who were committed to and engaged with their employer. And that's not really a clinical measure. That's really an indicator there's a whole bunch of issues around people's general satisfaction with their work and with their employer, their immediate boss, and so on, who were reporting better mental health, perhaps unsurprisingly. Those who derive satisfaction from their work, have autonomy and control over what they do, and who feel trusted, have higher levels of mental health as measured by WHO-5. Those who are content with their work-life balance, those who feel supported and motivated to work from home. We found, for example, a significant minority of people were worried that important decisions were being made without their knowledge, and feeling isolated from the general sort of chit chat and flow, and even some of the more formal communication in the organisation. And we found that those people who felt more involved and more had more of a stake in things were much more likely to report better mental health outcomes. Those people who had more frequent direct contact with their immediate boss were reporting significantly better mental health. And in a way, it almost didn't matter what the quality of that was. It was just how frequent it was. Obviously, the more supportive and empathetic and thoughtful their bosses were, the better. Those who had fewer physical health symptoms, unsurprisingly, were experiencing better mental health. Here's a graph again showing, plotting the WHO-5 scores against those people who are reporting greater severity of aches and pains in these sites of their bodies. And again, you can see pretty much across all the main areas of physical pain that mental health was strongly correlated. So worse mental health strongly associated with worse physical pain symptoms. And then, perhaps unsurprisingly, again, mental health was better amongst those who intended to stay with their employer. We've had about 1 in 5 of the workforce that we surveyed also reported presenteeism, so they'd actually continued working even though they were unwell. And that's not that far away from what you'd find prior to lockdown. But obviously, one of the big challenges we have is how do we now measure sickness absence, attendance, presenteeism, and so on. It's a bit of a conundrum. So I think the labour force survey data on sickness absence in a year or 18 months' time is going to be interesting reading and even more interesting interpretation. Quick look at work-life balance, communication, and morale. Again, it sort of reinforces the wider view that we've known for a while, that the important dimensions of job quality are strongly linked to wider well-being in the non-clinical sense. Being trusted to work remotely, feeling involved in decision making, feeling you have a voice is really important. People have variety and control, they feel valued, getting a sense of accomplishment and achievement from their work. Those who felt better able to manage the boundaries between demands of their work life and their non-work life, and then having contact with their boss and other colleagues in their team, are really strongly related to wider well-being as well. There's a whole bunch of other things that we can be doing with this data, so we've only really started mining it in more detail, but we can track some changes in self-reported health weekly since the lockdown. You've seen we started to do that with the musculoskeletal pain. I think there's more focused analysis to be done on the well-being of managers. 40-odd% of our sample managers were managing people, and this is a sort of so-called squeezed middle. And I think we need, if we're going to sustain remote working and working from home for a larger proportion of the workforce, I think we need some real investment in understanding how managers can learn from their experiences of the lockdown, how they can be supported, both in terms of their own health and well-being and their own working practices, to, for example, identify the early signs that someone in their team might be suffering from psychological distress, without having the advantage of close observation of their body language or their mood and so on. Doing it over Zoom is a bit tricky. And so I think there are a whole range of things that we need to do to help managers understand the wider concept of well-being, what their role is. I think it's pretty clear that if you're a manager who doesn't understand that a working parent may have some role conflict, for example, then you need some support to help them to do that. If you're not naturally empathetic as a line manager, I think you will have struggled during lockdown. and so indeed will some of your teams. We're doing some more multivariate analysis to identify what the most important drivers of mental well-being have been under lockdown. There's some sort of hypothetical models that we're kicking around at the moment, looking at the relationship between some core variables on the left-hand side, some of the subscales that we've produced as a result of our analysis, looking at some of the moderating variables that might have an effect on mental health. Some of our data suggests some quite strong associations and correlations here. We're going to be doing some more detailed regression analysis to see if we can identify what the sort of weight and indeed the direction of some of these relationships might be over time. We've also had the advantage of, and this wasn't planned, but we've had a number of people internationally asking us if they can use our questionnaire. And so we now have data from some mirror surveys that have been conducted internationally in India, Republic of Ireland, Brazil, United Arab Emirates, Mexico actually as well. So we reckon that we now have data from probably close to 7,000 or 8,000 people using the same questionnaire, looking at obviously different populations. And the early data I've seen suggests that there are many similarities, but also some important differences. Some of those are cultural, some of them about how work is organised and so on, some about family structure and support that people get at home and so on. But we're hoping to publish some results from that analysis early in the new year. So what about lessons, challenges, evidence gaps and so on that I think we need to tackle over the next few months and years? There's quite a long list here. I won't dwell on all of them for too long in the interest of time, but it's really clear that there's been a lot of work. Our survey is just one of many. I've noticed that, for example, the European Working Conditions Survey, European Foundation, have done their own survey looking at people's experiences of lockdown across the EU and beyond, which is in the process of being rolled out. There's some good work done by Adam Felsted at Cardiff, looking at home working as well. So there's no shortage of data in this area, and they're all sort of broadly pointing to some of these challenges that we need to really grapple with. I'll go through some of them. So remote working is clearly something that, somewhat upwards of 80–90% of people are now saying that they would like to retain the ability to work at home for at least part of the time. And indeed, something like 2/3 or 3/4 of employers are also saying that that's something that would suit them as well. So there seems to be a consensus, at least at the moment, that remote working is not going to go away and will be extended. Whether or not we're quite ready to embrace it efficiently or effectively, I think remains to be seen. But clearly there are issues around management, communication, the role of technology, how people are coping with isolation. One of the questions that was asked in the Republic of Ireland version of our survey was about introversion and extroversion. And the early results suggest that people who describe themselves at least as being more introverted seem to be coping better with some of the challenges of working at home, perhaps not surprisingly, but perhaps a bit more research into how personality might help people adjust to home working perhaps better than others. Work-life balance, I think, is a challenge. I think that obviously that's had a lot to do with schools and whether or not schools have been back or not. But I think there are some early results from other studies that suggest that the division of labour in the home between men and women particularly has adjusted a little bit and a bit more equal distribution of tasks, perhaps not as much as we would hope for, but helping people navigate in a sort of guilt-free way the challenging boundaries of work and life, I think, is something that some organisations have done pretty well on and others stubbornly resisted doing anything about. For me, one of the big ones is how we manage performance and productivity, indeed how we even measure it. In most organisations I know, unless they're manufacturing things, don't measure productivity anyway. And so I think we have a big challenge about working out whether or not productivity has gone up or down. The Felsted study from Cambridge, again based on Cardiff, based on self-reports, suggested about as many people saying that they thought their productivity had gone up as those who thought it had gone down. I think this remains both a methodological challenge and a challenge for management to really work out what does performance and productivity look like when people are working remotely, and are we focusing at last on outputs rather than inputs. The pressure that some people feel to log on at 7 in the morning and log off again at 7 at night or even later hasn't gone away in some organizations. And I think having an honest conversation with people about how their performance is going to be managed, what their targets are, how their performance is going to be monitored, what say they have in any of that, is a really important part of how you keep organizations going. But also it's a really important part of the hidden aspects of well-being. If people feel that the rhetoric of the organization is that we're really concerned about your well-being, but by the way, let's crank up productivity even more, can be sometimes a conflicting message and needs to be managed effectively. And I'm not sure that's always been the case during lockdown. Actually, I was speaking to someone the other day working in a large organization who said that there was still a significant number of senior managers in their organization who felt that pressure and stress were better drivers of productivity than well-being. Now, that if that's the attitude amongst even a minority of senior leaders, we've still got some more work to be done, I think. On mental health, I think it's really important to perhaps revisit the fundamentals of the good old demands and resources model, because lockdown has given us a new lens to look at that. How are people's job demands changing? To what extent do they have the psychological resources, including support from the organisation, to help them manage those demands and balance them effectively? Because it's a dynamic process. It's not fixed. It's not just driven by the narrow design of your job. It is about the context within which you're doing your job as well. So the job demands model, I think, and resources model is one that we revisit in the context of lockdown. That leads us on to talking about job design and job crafting. I suppose that what I would say here is that job design is always a really important lever, particularly a preventative lever in helping organisations fend off work pressure and other health challenges. The renewed interest in job crafting, I think, is interesting because it's a much more employee-led way of helping people to self-manage adjustments to the demands of their jobs, not just in terms of managing uncertainty and ambiguity, but also managing their demands on their job. And I think we're going to see quite a big increase in the research on job crafting, which I think is gaining momentum. I've talked about absence and presenteeism. We measure that. Upskilling, I think, is something we're ignoring. To what extent have really people been investing in their skills during lockdown, particularly those people who've been on furlough? There's not very much data about this. It's obviously something that will help people to cope with the rough seas of the labour market over the next few months, particularly as jobs disappear and organisations restructure. Again, we know that investing in skills, feeling that you're developing and growing as an individual is good for people's well-being more generally. And I don't think we've got very much data on that. The role of trade unions, not much talked about. I think in the early days, there was some discussion about whether or not the government really ought to be using the considerable experience of trade union health and safety reps much more in helping organisations and workplaces be ready for the return to work. Again, anecdotally, I'm hearing from many employers that actually collaboration and partnership with their trade unions during this difficult time has actually improved massively, and that actually there's potentially an opportunity for us to really embrace a better climate of employee relations going forward, because I think we all need to work collaboratively together to make sure that workplaces are safe and fulfilling and give people the opportunity to thrive. Line manager capability, I'd say, is another big one. I've mentioned that a bit before, but how do we make sure that line managers themselves are well enough and are able to and are resilient enough to be able to cope with the challenges of managing remote teams, but also to what extent are we investing in their capabilities? Many of them are brilliant at this anyway. Some of them find it much harder, and I think we need to help managers to manage people effectively, including learning how to look after their well-being. I've talked about prevention, making sure that we've got early interventions in place for people who are potentially suffering because of working from home. And I think that's, again, something that we need to just recalibrate, because it's not just as simple as kicking someone off to occupational health. I think that we need to think a little bit more carefully about how we build prevention into the way we do things, and that we've got good signposting for the support that people need as early as possible. Vocational rehabilitation has always been important as a multidisciplinary approach to managing return to work. Again, I think with reference to returning to work after lockdown, vocational rehabilitation, particularly for people who are in the vulnerable group or people who are living with chronic or fluctuating health conditions, really needs to be given much more prominence and profile. And of course, we have seen big widening gaps in inequality in some groups and some communities. And I think that's something we really need to watch out for, because obviously gaps in inequality in terms of employment outcomes and healthcare outcomes are very closely linked together. And that has to be part of organisations' diversity and inclusion strategy too. Nearly there. So I think there's some questions for some key players here. So are senior leaders more convinced now that wellbeing should be a strategic priority beyond being a business continuity risk? And more precisely, can occupational health and HR grasp the opportunity as professionals to mainstream workforce health, or will it revert to being about employee benefits, or what Dr. Litchfield elegantly calls fruit and Pilates interventions, which are all very good, but really aren't enough to help manage the complexity of a working age population where chronic ill health and so on is growing as the workforce ages. What sort of HR processes might need to be reassessed in the light of COVID-19? I've talked about performance management, but there are things about reward, progression, training and development, and so on, which are all linked to the wider well-being of the workforce. And then from a policy point of view, just the fact that we still have quite resolute silos in policy between health, welfare, employment, the Treasury, and so on. To what extent do the barriers between those silos prevent more joined up thinking and perhaps represent a risk to effective and sustained improvements in outcomes for people? And I think that's something that really needs to be tackled at the top of government, because I think so often we see individual initiatives which are not connected to each other. How much progress are we making, for example, about getting healthcare professionals to think about work as a clinical outcome of their care? I think we've seen some progress, but to what extent that may have been set back a little bit by the pandemic remains to be seen. So I think there are some political and policy challenges that need to be grappled with. IES is carrying on doing quite a lot of work in this area. There are a couple of projects just to bring your attention to, because they're sort of just starting. There's a piece of work we're doing with Southampton Business School and Half the Sky, which is a consultancy that does work on flexible working, funded by the ESRC, where we're tracking 2 organisations in local government and 2 in the legal profession, and then carrying out surveys to look not just at well-being, but work organisation, culture, how people are managed in the year after the official lockdown was ended. That website was only launched this week, and we're cracking on with that at the moment. And that's going to be a really interesting mix of quantitative and qualitative analysis that tracks people over time. Similarly, for the Centre for Ageing Better, we're doing some qualitative research with 20 older workers over 50 who are living with chronic and fluctuating health conditions. And again, we're tracking them over time, doing interviews with them. Some of them are completing journals for us and so on. So I think what this illustrates is that despite how awful the whole thing has been, this has been a really interesting time for people doing applied and academic and clinical research. I think we're learning a lot. I think one of the big challenges is how we pool those insights and help practitioners, policymakers, healthcare professionals to pick out the really important findings from what we're coming up with through all this research. There was a big rush to get research funding in place, and many of the funding bodies have done a great job to get money to people quickly to do really important research. I think at some point we need to press the pause button and have a period of reflection. And I think there are lots of learnings from this whole process. My fear is that it just gets lost in the rush to publish in peer-reviewed journals, and people get very proprietorial about their data. I think we need to find some way of pooling that insight so that we can have a calm and reflective approach to thinking about what we've really learned and draw out the things that will help us manage the challenges, which will remain for several years, I think, into the future. I'm going to stop there. If you'd like to know a bit more about the work that IES is doing, if you have any specific questions that you don't want to raise in the rest of this session, would like to find out more about what we're up to, please do contact me. But I'll shut up and let you put your questions.
Great, Steve, thank you very much. That's got so much in it that I think people will need to digest it with care. I may have mentioned to you before, somebody told me recently that it wasn't so much working at home as living at work. And I think you pulled out a number of those issues. I'd be quite interested in a couple of areas, but I know that there are people waiting to ask questions. So I'll pass over to colleagues before asking my questions. I'm going to ask people to ask their own question, to unmute. And Randy has a couple of questions, so why don't I go first of all to you, Randy?
Thank you very much. I really appreciate this very insightful talk. I think at the very beginning, unless I missed something, you said burnout is back. And what was that about? Can you tell us more? Or was that just a teaser for everything you were talking about? The second question is there any data on physical activity? We know how important that is in prevention, but I didn't see it in the challenges and gaps. Thank you.
Okay.
Good question.
Yeah, thank you. That's a really good question. I'm not sure I got a particularly satisfying answer to the first one. My interpretation is, and there are people on this call who've got far better knowledge from a clinical perspective than I have. But my sense is that burnout has always been a slightly poor relation, partly because of definitional challenges. You know, is it really a form of psychological distress? It's a bit like the debate about whether stress is really a medical condition or a risk factor and so on. It does seem to me, just from things I've noticed in the noise and the literature, that there seems to be a more renewed attention on what burnout actually is and whether it's actually distinct as a concept from psychological ill health, depression or anxiety, for example, or distress or trauma. And it does seem to me that what's happened in the pandemic is that more people have started using the term burnout, and there's been a bit more focus on whether burnout is actually a thing which has a distinctive set of measures. I'm not sure quite where that debate has got to. It was just more of an observation, but there may be other people on the call who can perhaps shed a bit more light on it.
Yeah, before you move on to the physical activity, Richard Caddis has made a comment about burnout. Might want to add to your comment in the chat, Richard?
Yeah, just to pick up that point, I'm wondering if it's true burnout, as you say, Stephen, and is it actually a fizzle out? Are we starting to just see people trying to adjust in the short to medium term of very different, not just ways of working, but also ways of living? So all those traditional protective measures, our social contact, our community sort of involvement, and all of those sort of 5 ways of well-being that we all used to rely on have in some cases all but gone. But certainly in the early stages of lockdown, we were seeing a lot of people becoming vulnerable who never would have considered themselves as such. Is that perhaps a better definition? And as you know, as with long COVID, is this a new emerging condition for this, next stage of industrial revolution?
Yeah, no, I absolutely get that. I think that there was a sense that lockdown was almost promised as a temporary phase. We all need to hunker down for a while, but it will all be over, and through our collective efforts, it will all be fine. And obviously, what we're finding is that's not been the case. And as we enter autumn and seasonal affective disorder and a greater sense of collective gloom, whether or not the things that have sustained us during a time when we thought that we only had to keep this going for a few weeks or months, the reality is dawning on people that actually this could represent quite a significant, perhaps even permanent change to some aspects of our lives. And as you say, some of those things that sustain us during a time of difficulty are wearing a bit thin. So it may be that it is about fizzling out, or people, just not being able to sustain the resilience that they might normally have, and don't have those sort of, particularly those of those working at home, don't have access to the same type of sort of social support. The other thing I hear quite a bit is that, not only are younger people reporting slightly poorer mental health, they're the ones who also are more likely to say they would like to go back into the workplace, partly because of, their living conditions, having to live in shared homes and so on, but also because they do miss the social side of work a lot more. So it may be that this is playing out differently for different subgroups of the population. And all I suppose I'm raising is that we perhaps need to look at something which may or may not be called burnout, as people's ability to sustain high levels of psychological functioning through all this may be challenged. So
can I take a question from Xenia next, if she could unmute, and then
can I just say by thing, Christine, on the physical
please do.
We didn't collect any more data on physical exercise, but I think there are other surveys. I think the ONS data and various others, I think Understanding Society and a few others collecting some of that data. But I don't want to underestimate that, partly because obviously of the impact it has on people's physical health, but also on mood as well. And it'd be interesting to see which subgroups are able to sustain good levels of at least moderate physical exercise. But I don't have any data on that myself.
Thanks. So Xenia, followed by Paul Litchfield. Xenia, are you unmuted?
Hear me?
Yeah, we can.
Oh, sorry, I'm having some mic issues. Yeah, Xenia Kumi, public health specialist at the City of London and Hackney. Stephen, thank you so much for such an interesting presentation, and there's so much to take away from that. I had a quick question. So, because this survey is obviously focusing on sort of white-collar workers working from home, are you aware of any studies that are sort of focusing specifically on sort of routine service and manual workers, or is anyone else aware of any?
Yeah, I think the Adam Felsted Cardiff study, I think they surveyed 3 waves of people across a range of occupations. And I think also the Eurofound, the Dublin Foundation, have been collecting data from something like 28 countries, again, from across a range of occupational groups. I would say that the Eurofound data is quite good to look at because they're quite good at on their website having data visualization tools, so you can actually do your own interrogations of their data. But they will be rolling out, themed reports from their data, and they've just started in the last 2 or 3 weeks to disseminate their work. So the European Foundation in Dublin will be a good source, I would say.
Thanks so much. So Paul Litchfield, followed by Tom Levitt.
Thanks, Christine, and thank you, Steve, masterful as ever. One of the things that worries me as we move into eventually a post-pandemic world is that a lot of companies will make decisions on home working based on narrow financial considerations, looking particularly at cost savings in terms of office space. And as more and more of us work in a knowledge economy, what worries me is that may have an impact, certainly my anecdotal experience is that it does have an impact on team working and particularly creativity. And I wonder if there's any evidence to back up that assertion.
Yeah, I think, hi Paul, I think that's absolutely right. And I think that's an issue that predates the pandemic. I mean, I remember several years ago a study that Xerox conducted where they basically stopped their maintenance engineers from meeting in the morning in one location before they disappeared off to do all their jobs, when they got all their tools and had a cup of tea and so on. And they thought that they would save some money if they closed that office down and just people went straight to their maintenance jobs from home. And they found that things like complaints and errors and so on went up massively. And of course, what was happening was that there was all sorts of informal interaction and swapping of know-how, as well as, the bonhomie of meeting your workmates a couple of times a day. They realized that actually the sort of informal social connection of work was actually really high value to them. It meant that, you know, knowledge was being shared. It meant that tips and tricks were being shared, and that customers were benefiting from it. So I think it can sometimes be a false economy. What we are seeing are more organisations, I think, talking about sort of intermediate hubs where teams can get together temporarily or for certain times of the day. You've got, you know, stories of A teams and B teams going back to work in sort of rotation and so on. So I think some organisations are recognising there are some tasks that can only really be performed well where people have access to sort of face-to-face communication within their team. And I think, you know, solving difficult problems, coming up with creative new ways of doing things, or innovation in product or service delivery, all those are sort of things where actually having a whiteboard and a big pot of coffee and people just, you know, working hard for a few hours together are really quite hard to replicate remotely. And so I think the challenge for organizations is to avoid the knee jerk, as you suggest, of you know, looking opportunistically for savings in their estate, to thinking creatively about how they can use a variety of working patterns and work locations to help optimize the creative potential of their workforce, and to really think about what being a knowledge worker and a knowledge organization looks like. Because organizations for many years have sat upon these intangible assets of their knowledge and know-how in their organizations. This has brought to the fore the challenges of how they optimize that. And it's not so binary as just thinking, are we either working at home or we're working in an office. We need to think about intermediate and variable approaches to work organization that optimize productivity, but also the quality of working life.
Thanks, Steve.
Thanks. Moving on to Tom Levitt. And then he seems to be the last question in the chat. I've got several, but I'm sure other people have some more as well. Tom, over to you.
Thank you. Good to see you, Steve. It's been a while since the Work Foundation.
It has, yeah.
I wanted to ask about the people left behind, those people who are still at work. Do they feel that they're being put in a more exposed position? Are they running a higher risk of the virus? Does that make them feel that they're not getting the benefits, if you like, of the flexibility that home workers have got? It seems intuitive that people on furlough will either feel more liberated or more vulnerable, more at risk of losing their work halfway out through the door, as their mental health being looked at. And I wonder if there's a correlation between your findings and the size of the organisation, or is it just difference between good management and not so good management as to whether it works or not?
Yeah, okay. Yeah, thank you for that, Tom. Well, I think those people, there is definitely a sort of you know, divide, and there has been right from the beginning of lockdown between those people who in key worker roles, and it's not just people in frontline NHS or social care, but it's, you know, retail workers and delivery drivers and a whole bunch of people who've kept the lights on and kept things going. I think that, you know, that group has, to a greater or lesser extent, has always felt a little bit less privileged than those people who have been able to work at home. There's a sort of, you know, quite a big division in some ways. I think that with some notable exceptions, most of them have been given relatively rapid access to the type of support that they would need, obviously in terms of preserving their physical health and protecting them from infection. But I think most organisations that I've seen who are employing key workers have been pretty good at putting in place good psychological support. I think that, you know, there has been a recognition early on that those people are doing a great job and a very important job, and it's made us think, of course, you know, who are the key workers? Is it a hedge fund manager or someone, you know, working in a Tesco local? But I think more work needs to be done to look at how that's sustained over time. Again, there was quite a lot of focus early on. We've not really looked at them and how that's going to be sustained over a long period of time. I think people on furlough are an interesting group, and probably not a quite heterogeneous group, I think, in some ways. There was a bit of chatter before we started the webinar, actually, about how this is affecting people in developing countries. And I've got a colleague who's an occupational health nurse in Ghana who's written a guest blog for the IES website, which we're going to be putting up in the next couple of weeks. And she was saying that you know, a lot of issues around stigma for people who've had the virus, And there's also an issue around stigma for people who've been on furlough as well. Not all of them, but I think that some organisations have not managed that very well. So I think there are little groups of people who, through their experience and not always, if at all, through their own fault or volition, may have found the experience a little bit more isolating and exclusive. And I think that's something we do need to watch out for. You used to hear anecdotally people who've been coming back from furlough being asked how their holiday was and all that sort of stuff. You know, many of those people are going to be at risk if redundancies kick in. So we need to treat that very seriously and look at that group. On the size issue, I think obviously large organisations have got a better access to occupational health and a whole range of other support mechanisms and so on. I would say my experience has been that small organisations are a lot more agile and able to look after people pretty well and to react very quickly to challenges and problems. And also, by and large, people tend to know each other very well. They know about their domestic circumstances as well as their work. And I would expect most small firms to be pretty good at this sort of stuff. They might need some help with people with extreme issues of their physical and mental health. But in general, the way that they manage people should allow them to be better at managing the short-term and indeed medium-term problems that people have.
Thanks, Steve. So I wondered to what extent you'd picked up the issues around type of housing and type of travel to work as factors.
Yeah, I mean, some of those we picked up in our IES survey, and there's certainly some of those that we're going to be picking up in our work after lockdown study for the ESRC. I think certainly we found, as I mentioned, that those people living in private rented accommodation, people living at home, tending to be younger, were experiencing bigger problems with just finding a dedicated space where they could work uninterrupted. That's notwithstanding the childcare issue. And I think people who found that hard are the ones who are experiencing more mental health problems, but also wanting to get back to work at least in some form as possible. We also do know that one of the biggest benefits that people say about working from home is just not having to commute. And that's just about quality of life, travel time, the cost, and so on. But it also represents one of the big fears in terms of, you know, when you talk to people about the things that they're not looking forward to, or the things that might be a disincentive to them returning more regularly to a workplace, it is the fear of, aside from going back to a commute, which obviously you know, not many people would like anyway, it's the public health challenges, the risk of infection, you know, sitting in crowded buses and tube trains and so on. It's certainly one of the big factors. And I think that even if you can make your workplace safe, as far as humanly possible with all the safeguards, actually getting into the office is the big challenge. And even things like, you know, how many people are allowed in the lift in a tall building, you know, presents really difficult challenges. You know, not even taking into account some of them might want to go out to lunch. So, you know, there are lots of practical issues that I think organisations are having to grapple with, not all of which are in their control.
I have, this is very anecdotal, I have a colleague who at the beginning of lockdown who lives with small children and no garden. She said everybody else is buying lentil beans. She bought a trampoline to keep her kids full of getting rid of their excess energy. But I think as you've said, the issue of children at home is has been really challenging for many people. So on a completely different level, I wondered what your thinking was around some of the recent comments about types of supervision and monitoring home workers, which feel uncomfortable from where I sit.
Yes, there's been a lot of speculation around whether or not organisations are going to take this as an opportunity to increase the amount of surveillance and performance monitoring and so on. You know, technology can afford them the opportunity to do that. And obviously that's been a feature of work in some occupations, in some sectors, even before the pandemic. So perhaps it's just a continuation. But I suppose one of the lessons from our survey is that there have been some managers who've been surprised and perhaps a bit disappointed that people can get on with their jobs without very close supervision. Line managers need to be checking in, but actually it's been quite liberating for a lot of people who've had a lot of what they do and when they do it prescribed by procedures and protocols and so on. We got quite a lot of really positive things from our survey, where people have felt that actually they've been given opportunities the first time to be trusted, to have high levels of discretion and autonomy of how they do things. And in some ways, that's more of a challenge to those managers, who I hope in the minority, who feel that a command and control approach to managing, what Paul would call knowledge workers, for example, in a very prescriptive and prescribed way. So I think that, one of the lessons we can perhaps draw from all this is there's an opportunity to see that there are other ways of managing people, that, consent is really important, that high levels of involvement in decision making can make a big difference. And, those of us who've been looking at the concept of good work for many years know that's true anyway. We've just been catapulted into a slightly artificial situation over the last few months, where we've had a sort of natural laboratory for looking at how those things work. And so I think, if you're a manager who thinks that a random act of kindness is a sign of weakness, you've had a bit of a wake up. Smart organisations are already doing. Other organisations need to follow along quickly.
Thanks. We have a question from Elaine Wainwright. She can unmute, Elaine. And
hello, Steve. Thank you for that. That was fantastic as usual. I just have a question. You showed data that pain rates increased in the beginning of the lockdown, which then receded, but that pain is still a problem for about 1 in 4. And I just wondered if you could say a little bit more about how we can best support people in pain at work in a pandemic and post-pandemic context, sort of bearing in mind what we know about good work and good work for people in pain. What do we do with that now? Thank you.
Yeah, really good question. Yeah, I think, I'm not sure this is something that employers were particularly good at before the pandemic, because obviously, pain is invisible, and there's all sorts of folklore about pain and what it is and what it isn't, and whether it's, a disease in its own right or, associated as a comorbid condition with a whole range of other things, and the role of mental health in all this. I think the fact that people in our survey were being candid about the fact that they were experiencing pain is a good thing. I think there remains, more work to be done to get organisations to recognise that if people want to disclose that they have chronic pain, then they need a safe environment within which to do that. I would hope that those organisations who already have in-house or subcontracted OH services would have a good deal of insight about this. But I think we need to recognise that pain is a multifaceted phenomenon, and it's not just about whether or not you've got a good desk or workplace setup or you're hunched over your laptop. People can be living with pre-existing conditions where pain and fatigue and so on can be strongly associated with those conditions. And I think we just need a bit more enlightened approach to allowing people to talk about them. I think that we therefore need to think about what sort of workplace adjustments and accommodations will support people living with chronic pain, because it's not just as simple as getting an ergonomist to look at how someone's workstation is set up, although that of course can be very important. There's a strong psychosocial dimension to pain that we need to recognise, and even some studies that suggest that just how you feel about your immediate boss or the leadership of your organisation can be strongly related to your own experience of pain. So now is the time, and I can't think of many better people than Elaine to be pushing for this and to advocating on its behalf, given your amazing research in this area, to really think and reappraise where we think we are with pain in the workplace, because it is invisible. If all you're doing is looking at someone from the shoulders up on a Zoom call, you need better ways of helping them to both disclose and for you to support their ability to continue working productively and happily when they're living with chronic pain.
Thank you, Steve. That's really useful. Thank you.
yeah, thanks for all the questions. There don't appear to be any more coming, but if you've got one almost popping out, please do. But if not, I might ask Steve for his sort of final thoughts and messages, just in case any more pop up, but it would be good to have your final thoughts. You've still got a very big audience, so any more that you want to say, Steve, fire away.
Okay. Well, I mean, I suppose one of the things I was reflecting on when I was putting the presentation together was that it would be possible to come away from this thinking that things were a bit gloomy during the lockdown, and obviously for many people they were for all sorts of reasons. But I prefer to think about the positive take on it. And although our data suggests that quite a few people have experienced a whole range of health and well-being challenges, I think that there are lots of positives to take from it. And I think there are many people and many organisations who've had perhaps a surprisingly positive experience of lockdown. And we now know a lot more about how people have adjusted. You know, this isn't a one point in time. You know, lockdown was a process and a journey, and some of our data suggests that actually some things got worse, some things got considerably better. And, you know, this is partly about how organisations manage change and agility and challenges and so on. But for the most part, many of them seem to have coped pretty well. And so I suppose my big takeaway from this is how can we really build on the data from this and from other studies to make sure that if we are going to be moving into you know, a new way of working or adapted ways of working, that we build on those lessons in a way that's positive, so that we can make sure that this whole concept of good work and autonomy and challenge and, you know, trust and so on get sort of baked into the way we do things. I'd also like to congratulate myself on not using the term the new normal throughout the whole presentation.
So we've a question from someone whose mic I think isn't working terribly well. Derek, come in if your mic is working, but if not, we can read your question from the chat, which Derek says he wonders how the increase in societal vulnerabilities and hence insecurity will have on long-term mental health. Is an accrual of events, COVID, furlough, redundancy, then outside happenings. Are we planning right in OH and business, or are businesses being too optimistic?
Really good point. I mean, I think that's where these two areas of work that IES is doing, looking at, you know, the labour market implications of pandemic and the workplace implications come together. Because what is really clear is that, you know, you only have to look back to the 2008, you know, Great Recession and the financial crash and so on to look at what happened to the jobs market after that. Not unsurprisingly, many employers were very reluctant to dip their toe back fully into the recruitment market. And we saw quite a significant growth in what you might call precarious work, you know, people working part-time, temporary contracts, and 0 hours contracts and so on. It never got above 4 or 5% of the total workforce, so we mustn't run away with the idea that precariousness is the norm. You know, most of the jobs growth was still in full-time or permanent employment. But what is really clear, and again, actually a colleague of mine and I presented some results from the European Working Conditions Survey on this last year, that precarious work is strongly associated with poor mental health. And the greater the elements of precariousness in work you have, the greater the risk is. And so if employers, for perhaps rational business reasons, are not prepared to re-employ people on a more permanent or stable basis, the thing they do have to recognise is that mental health is one of the things that may suffer as a result. So I do think that you're absolutely right, that precarity, the nature of work going forward, the type of sort of psychological contract that employers have with their employees in a period of uncertainty, all things we're familiar with, may play out slightly differently in the post-lockdown world. And that's certainly something our ESRC study is going to be looking at, you know, in terms of culture, norms, psychological contract, well-being, work organisation, role of technology, quality of management. They're things that were front and centre of that study. And we're hoping to have some interim findings on that before Christmas. So please do check out that the Work After Lockdown project, because that's absolutely firmly in our sights.
Thanks, Steve. So Nick, you're coming in with a question, I think.
Yeah, hi, Steve. So I sometimes get asked, you know, where should the focus of attention be on mental health for kind of interested charities and others who kind of want to make a difference? And you know, obviously it's a mixed picture, isn't it, the mental health side? But if you were kind of sitting with a nice budget and wanting to kind of do interventions for a specific group, in mental health, considering what we know now, what would you do, or would you still? I mean, I absolutely take your point. And we need to reflect, and actually, it's a bit complicated at the moment. It's difficult to identify where interventions are. But if you wanted to kind of go ahead and do something, you know, with I don't know, we've got £1 million, what would you do? Not that we've got £1 million, but sometimes I have these conversations with people who just want our advice, and I'm a bit unsure, to be honest.
Yeah, it's a good point, and there's something that's come up a few times in the last few weeks in conversations I've been having with people, and I certainly don't want to paint the picture that, you know, all the support that we have available for people who are presenting with mental health problems is great, although it's a lot better than it used to be, and I think that we sort of know which interventions, once people present, work best and that people need better access to. I would probably think about going more upstream. Earlier this year, we published some research that was funded by Shell, where we were looking at the mental health and suicide risk amongst seafarers. And that got us into this whole issue of weak signals. You know, if you're on a tanker and you see a little dribble of oil down the engine, you see that with looking at it from a health and safety perspective as potentially the first step in a chain reaction towards something potentially very serious. And that your health and safety mindset says that's a really weak signal of something that may, in the wrong circumstances, go badly wrong. And the thing I'm interested in, whether there's an analogy there with mental health at work, whether there are weak signals of people suffering from mental distress in the very early stages, where we could look at things like, you know, work instability, as we have with people with rheumatoid arthritis and other physical health conditions, whether we need to think about how the early signs of mental health or distress, which are either work or non-work related, can be picked up much earlier, and whether we can program into the way we organize work and design jobs and so on, based on what we know makes a difference to people's psychological well-being, so that we're not, you know, as an occupational health physician, I'd listened to a presentation from, I can't remember who it was now, it may have been Steve Borman or someone else, who said it was a bit like being at the bottom end of a fast-flowing river, pulling out the bodies, and saying to yourself, one day I'm going to go upstream and find out who's throwing the buggers in. And I do feel sometimes we're in a situation where, you know, we manage to put together resources and signposting and support for people who are already living with a mental health problem, but we don't do enough upstream to try and work out what the causal factors are. And it's a bit like the prevention is better than cure argument. And it does seem to me that in workplace settings, equipping managers, occupational health professionals, HR people, and indeed employees themselves to spot those weak signals about, you know, how we're organising work or whether the organisation is managing change well and so on. It's not a clinical thing, I don't think. It's just an understanding that if you get that combination of factors about how you manage work ineffectively, get that understanding together, you could actually do a lot more upstream to make sure that fewer people are living with a mental health problem, which becomes more serious down the line.
Thanks so much. That's really helpful. Thanks, Dean.
Thanks, Nick, and thanks again to Steve, and thank you, the audience, for being such a great audience. Steve, thank you very much indeed. I think you've told us a lot, you've stimulated a lot of ideas, and people will undoubtedly look again at your slides, and I'm sure we'll be in contact and hearing more as this quite unprecedented impact on people's work and working lives continues, as it certainly will. So many thanks, Steve. Look forward to staying in touch. Thank you all very much for coming along. We have another webinar in 2 weeks' time, and Nick's going to remind me, but I think it's on mental health.
Yeah, so we're very fortunate to have Emma Mamo, who's the head of their kind of workplace health team. So that's on October the 20th at 9 AM. So look forward to that. But now,
look forward to seeing many of you then. Thanks again, Steve. Thank you all for joining. Have a good rest of the week.